Hi, my name is Zachary Sharp. My client's name is Gina Thorsen. My client is a 32-year-old woman. The differential diagnosis for Gina Thorsen was dependent personality disorder. In this case, given the details of the client's story, the diagnosis for dependent personality disorder became a clear choice in accordance with her symptoms described in the case and the diagnostic criterion. The primary diagnostic features are is a lifelong pattern of excessive need to be taken care of, which manifests in submissive, clinging behavior and fear of separation. Gina Thorsen is 32. She works as a grocery clerk, and as she has for about 12 years now. She lives at home with her parents, though her father is largely absent from her life due to work. Not that she minds this too much. It is her mother that has a large impact on Gina. Gina's mother is domineering and critical of her. She is judgmental and seemingly nothing is good enough for her, especially not the client's romantic interests. These always end the same for Gina. Either she caves to her mother's incessant demands to break up for any number of reasons, or the boyfriend gets fed up with the enmeshed relationship Gina has with her mother and chooses to end their relationship. The client recently broke up with who she called the love of my life. She is distressed over this breakup, but fears challenging or disagreeing with her mother. Although Gina has a steady income from her job, she will not move out. She sees this as abandoning her mother. Gina is complacent in her living situation and at work. She has passed up multiple chances to advance to a higher position, but has denied these advancements due to a disinterest in taking more responsibility. Gina was a spoiled only child. She would cry when being dropped off at school and would often demand to sleep with her parents. Sleepovers rarely happened, and if they did, they were always at the client's home. The client fears upsetting her mother, but desires more out of her life, and has begun seeking solutions. On to the multi-axial diagnosis. Axis 1, none. Axis 2, dependent personality disorder. Axis 3, none. Axis 4, socially isolated, lives with parents. And Axis 5, the GAF, is 65. Finally, for the theoretical perspectives, we have the biological perspective, which says people with this disorder may suffer from increased feelings of pessimism and anxiety, which could be a contributing factor. There is also a genetic predisposition for this disorder. The family perspective states that the mother is domineering and authoritarian. She contributes to her daughter's feelings of helplessness and dependence because she wants to be able to control her. The mother has a lack of boundaries. In terms of the structural approach, this had made the relationship enmeshed, contributing to her disorder. For the behavioral perspective, we can see that a faulting learning experience could explain why the client is so dependent on her mother. Through operant conditioning, the client is having her dependent behavior reinforced. She is positively reinforced when she would receive praise for her behaviors, and negatively reinforced through avoidance of her mother's anger or disdain towards certain behaviors. Finally, for the cognitive perspective, we can see that her mother's parenting style may have contributed to the client internalizing her mother's ire and criticisms. The client has irrational beliefs which contribute to her dependency and feelings of low self-esteem. She believes she is unable to survive on her own despite good circumstances to do so, excusing the thought with the notion that it would be akin to abandoning her mother if she were to leave. That is all for this video. Thank you very much for watching.